Hey Mitzi, how are you?
Fine.
Good. You doing okay today?
Yes, I am.
Okay. Um, all right. We're gonna, if you can, sign this informed consent paper for me, please. It just says, you know, that we're
Giving you the
that
right
give me the information.
information.
Yes.
Okay.
Thank you. And what is it I'm seeing you for today, Mitzi?
Well, I have a little anxiety from being diagnosed and going through cancer several times.
Understand?
And sometimes I get down in the dumps, and sometimes I have to talk to myself and work my way out of it to try to have a positive attitude. It's basically, I want to be in a happy place.
Yeah. Yes. As we all do.
Hmm?
What tell me about yourself, you know, before you went through, you know, the cancer and all
Before
that.
I was diagnosed with cancer, I've always been a independent woman in a good marriage with a husband that backed me on all my business ventures. And when I got sick the first time, it wasn't really anything. It was just a little brown skin cancer, I think in '92 on my leg. And then in 1998, I was diagnosed with breast cancer. It was ductal carcinoma. And at the time, my husband has gone through a long process of losing his father. We were just basically waiting to lose him when I found this out. Well, I went to the doctor and they wanted to do a removal of the breast, and I kind of thought for a few minutes, and then I drove from Campbellsville back home, and I thought, I can't walk in that house with my husband waiting for his father to pass and me tell him I have cancer. So I told him everything was all right, and I waited till the first of the year, a few months, and then I went and I started radiation. And that put a little distrust with Ricky in there on medical issues because I did not tell him. And I went through about 28 radiation treatments, and then I took a drug called tamoxifen for about 5.5 years. That was to prevent breast cancer to come back. It was 2007. I got sick, didn't know quite what was going on, and I had stage 3 ovarian cancer. I spent weeks and weeks at a time in the hospital, major surgery, and it was a long process for me, and it was very scary because my survival rate, I had a 5 to 10% chance to live, and when you have that, you have this will that you've got to keep going, but then you've also got this, can I do this? Why me? I'm mad at the world.
Understandable.
And then when I would look at my husband and he would have this helpless look like he wanted to fix it, I couldn't stand to see that because he wanted to fix it, he couldn't.
Yep.
So we went through several months of chemo and back and forth to the doctor, and I would set little goals for myself. I would say, I want to live long enough to see my grandson graduate 8th grade. Then it was, I want to live long enough just to see this. And somehow, with experimental chemo and surgery, I'm here today. I went on, my father, who I'm very close to, got ill. And me being next to him here, it was hard for me to be nurse to my father, plus it being my father and me going with issues myself, because while that was going on, I had to have, my cancer came back, not the ovarian, but it was breast cancer again, and I had to have a double mastectomy. So I would get down sometimes, and you wanted to keep this big front. You smiled, you wanted to be happy. You didn't want anyone to know kind of how you felt because you didn't want to drag them down with you. So I learned that the shower was the best place to cry. Well, I started started getting sick again and didn't know quite what was going on, and I had to go back to Louisville and have a biopsy. And it really scared me because I felt that I knew that the cancer was back.
Yeah.
And I was waiting for the biopsy, and then I was with my father when he passed, March the 20th. And then that night I had to tell my mom I couldn't go with her to make arrangements because I had to go back to Louisville for them to tell me that my cancer was in. And it was hard. It was very hard. And it was hard. It's hard to explain. It's even hard to think of how I dealt with it because there was so much negative things going on at that time.
Yeah, I'm sure it was a difficult time for sure with all that going on, you know.
And I've always been the one in the family that kind of holds us all together.
Yeah. What, Mitzi, did you have any counseling during these
Yes,
stages?
I did. I did. I got depressed. I could not do things that I was used to being done. I was one at times having to be waited on, and I liked waiting on others and
Yes.
taking care of them. And it was very hard mentally because due to as many surgeries and chemo, you lose memory. You lose a lot of short-term memory, and you lose part of your speech. And where I was so used to doing things, I would get mad because I couldn't spell small words, I couldn't add anything, and it was very depressing. It made you so angry.
Yeah.
And I mean, I've thrown ink pens across the room or a book, and, you know,
Yeah.
had my little cry.
Yeah. What were some things you did to cope during these difficult times with it?
There were a few times that I literally had to sit down and take a piece of paper, and I had to sit and think about my day. On one side, I would put the negative things. On the other side, I'd put the positive. Some days you had to look a little harder, but the positive by far was more than the bad.
Yeah.
And I guess with the love and support that I had with friends and family too, I was so appreciative for that because I saw so many women going through problems in cancer at the doctors and the clinics that had husbands that left them, boyfriends that left them either over the money that this illness caused or just the fact that they couldn't deal with it. And I was so fortunate to have a husband that stayed right through me, right beside me but the whole way, and family and friends. And my grandkids kept me going because there was little goals that I wanted to see them, that happened to them in life.
Yeah.
And I wanted to see them to achieve what they wanted to do. And I did go to counseling, and it did help because I just sometimes needed to be guided a little way in the right positive direction. And sometimes, instead of without counseling, I think people tend to go to the more negative. And I found that it's okay to talk to someone that you feel stupid.
Yes, totally.
It's okay to talk to someone that you hurt. It's okay to take medicine that's prescribed properly and take it in the correct way.
Yes.
For your problem. I have medication that I take now, and I've tried to go off of it, but for some reason I can go about 3 days and one of the kids or my husband says, "Are you go off your medicine again?" Because my personality will change.
Yeah. What during these difficult times, Mitzi, I'm sure it was very difficult, but did you see any did you find sort of a sense of more positive things? Did you look at it different when this happened?
Well, I've always tried to be a positive person. As I call them, negative Nellies kind of get to me sometimes.
Yeah.
But then when I sat there and I thought of how blessed that I was to still be here and to have my family and to have my friends, I talk to myself, and it's okay to go there every now and then
Yeah.
to the sad pity me,
Yeah.
and it's time to get off your butt and look around at all the positive.
Yeah.
And that's what you have to focus on.
So I'd say, Minty, coming out of this, you definitely had a different outlook
Oh yes,
when you got finished, for sure.
yes, I'm living with cancer right now that came back 4 years ago. When they told me, I honestly thought 6 months.
Yeah.
Because it had metastasized on 3 organs. But somehow, some way, I stayed on chemo for 2.5 years straight. I went off of it because quality of life was getting rough.
Yeah.
And I just thought, I'm going to be okay. Now, I still go every 3 months. I have a CT. I can't put it over in the corner and just forget it. I know it's there.
Yeah.
But then it makes me realize how far I've come to where I thought I would not be.
Yeah.
It's been like I said, my father dying one night and me having to tell my mama that I had cancer again was very hard.
I would say, I can imagine it's very different.
It was hard watching him. It was hard telling mother. It was hard telling my husband, the kids. And when someone goes through something like that, it's not just the patient. It affects the whole family. It changes everything in the family. Things that I was used to doing that someone else had to start doing, or just all the way around. And I think it has brought us closer.
Yeah. So, I mean, I can see, that you going through this, you definitely had a positive outcome. You found more positive than you did have.
And there were
So to
days
say.
that it was very hard to find.
Yes.
And then there was days I had to dig deep in there to
Yeah.
find it.
Of course.
But it's kind of a choice. Every morning, like I said, I've lived with the cancer, and I live with the fact that I know that any day it could start growing. They've told me that.
Yeah.
I am their longest living stage 3 ovarian patient at Norton's in Louisville. And they can't tell me why. They just said, you've been here, others are over here. Part of it is, with anything in life, you can talk yourself into being, I feel bad. I'm not going to get up today. My head hurts. You can talk yourself into being sick and laying there.
Of course. I think, during life, I mean, especially during those times, I think it's, easy to be your own worst enemy.
Mm-hmm.
I mean, I'm sure that, there were times that, you look, of course, along with the positive comes the negatives as well. What was the most negatives that you could say you faced? Or maybe some of the most difficult times?
Part of that was kind of how I always saw in life. If something's wrong, I want to plan a correction so I can fix the problem.
Yeah.
But with this, there was no plan of correction that I could do. It was just you sat and you waited. You went to the doctor, and then you waited and twiddled your thumbs for a report, because some people might not want to know, but I was a person I needed to know. Regardless of what they told me, I wanted to know.
Yeah.
And then I had to see which direction I was going to go in it.
Okay, Mitzi, we're going to do a little technique here. What do you think that your purpose and meaning in life is? What do you think that maybe God gave you
I think
as your purpose and meaning in life?
I think part of it is God. He left me, I think, in a way sometimes for my family.
Yeah.
I've had to nurse my mother, nurse my father until he passed. I've gone through a lot with mother, Ricky's mother. I don't know. I don't know what. Sometimes I think, well, why me? In the negative way is why me? Why am I the one that's sick? And then in the other side, I was saying, why am I the one that is still here?
Yeah.
And I've always tried to be a positive person, and I've just tried to make whatever day or days that I have left here on this earth, I want it to be positive. I hope that I'm blessed to grow to be, not grow, I don't want to grow, but I'm blessed to age to 100 years old. You know, I like